So I wanted to hear a little bit more about the journal that you're working on, and I know that you in our conversation earlier you were talking about like indexing the journal. So just walk us through that and like why are you all thinking about doing this?
Yeah, so we want to make sure that students can get their work out there no matter what, given that their hard work should pay off within this fellowship experience. So we also recognize that a lot of the times, peer reviewed journals, that process can be really lengthy and can be very selective and very competitive. And oftentimes they have pretty rigorous expectations for formatting or for the number of authors or for word count and things like that. And so we definitely try to encourage students to submit to peer reviewed journals as much as possible, especially for the initial run. But we also recognize that sometimes it can be challenging, and sometimes students may not have the time or the ability to follow through with this full, like, lengthy peer review timeline, especially students who are about to apply to medical school or apply to certain postgraduate plans. So we also have internal, actually, internal is not the right word. It's called the Journal of the Health Disparities Think Tank. It's a publication that we started as an initiative of the board, and we support students who choose to publish in our journal. And we have it indexed with Crossref, which is one of the DOI indexing companies, so that students, if they decide to publish with us, they are also kind of contributing to the scholarly literature on health disparities, and that uh, we're also in the process of making different volumes of the journal, different issues of the journal, and we're working on disseminating the work as much as we can, potentially collaborating with other journals and other organizations to help disseminate the work that students produce. So this is just to ensure that students, their hard work will not be, it won't be, I don't know, wasted is not the right word, but it will be uploaded and seen by other people out there. So we do, like I said, try to provide as many resources as possible to students, whether it be mentors, like resource packets on how to perform this type of research, uh, you know, a wide network of policy advisors, and our most recent initiative is the journal to make sure that students have the entire publishing experience.
Well, Stephanie, you have your hands full with this health disparities think tank, being a student, and all the other things I know that you have going on. Is there something about the health disparities think tank that I didn't ask you that you'd like to share about?
So yeah, the last thing that I wanted to mention is that we also want to grow HDTT into as national or if not international of an organization as possible. So right now, most of our partners are Harvard affiliated. So many of our research mentors are from local, like, Harvard affiliated hospitals such as MGH, Brigham and Women's Hospital, Dana-Farber, etc. But in our long-term and short-term goals, we want to see more mentors from places across the country, especially with representation in different hospitals in serving minority regions, or advocacy groups, especially dedicated to combating health disparities of various minority groups. So that's definitely a goal of ours, is to help expand. So if someone's listening and you are from a minority serving hospital, or from a hospital or academic institution that we're not currently affiliated with, we'd love to keep in touch, get you on board, and potentially work with you to help provide this resource to our students. As well as students from, underserved communities, we are definitely open to any background, as long as, like I said, there's passion and commitment. So I'd love to, also take this opportunity to speak to listeners who may be interested in getting involved, and open that floor to you and let you know that we are more than happy to collaborate.
Well, thank you for sharing that. I wish you the most success in this and all the endeavors that you have going on in your life.
Thank you so much, Omar, and thank you so much for offering me this platform.
It truly, truly is my pleasure, and I'm looking forward to seeing how everything grows and how your career moves going forward.
Thank you, and it was definitely a pleasure speaking with you today as well.
Yeah, yeah, yeah.